PREGNACARE show is proudly brought to you by
Mineral Water.
Dole yogurt.
If I'm unable to deliver my baby through the normal vaginal delivery, then the next option is a cesarean section. It's a surgical procedure used to deliver a baby through an incision in the abdomen and the uterus. Having your baby through a CS does not make you less a mother. Remember, to become a birth mother, you have just two options to deliver your baby: through the normal vaginal delivery or through the cesarean section. Few times are some pregnant women unable to have the normal vaginal delivery, but rather a cesarean section. The question is, what puts me at a risk of having a cesarean section? What are the complications, or what are the reasons for me to have a cesarean section? On today's episode, we would be discussing everything cesarean section, causes of cesarean section, types, and everything that falls under it. Welcome to the PREGNACARE show. My name is Dede, and the show is brought to you by Vena Mineral Drinking Water and Dole Yogurt. On today's episode, we have Dr. Adolf Mensah with us again. So he's here to tell us everything about a cesarean section. Dr. Adolf Mensah, you are welcome once again to the PREGNACARE show.
Yeah, thank you very much.
So still for the sake of our viewers, we want you to give us a little gist about Holy Trinity Medical Center and Spa.
Okay, so at the hospital here, we have all the services from general consultations to laboratory investigations, to medical examinations, okay. The American visa. We do surgeries here. We see pregnant women, people who want to get pregnant, people who have problem before getting pregnant, and also the pediatrician too. We have the ophthalmologist who look at the eyes, okay. The dentist who look at the teeth, and at the spa, which is at Soho, where we do the massage and the other therapies.
So at Holy Trinity Medical Center and Spa, they provide all the health services you want. And the spa is located at Sogakope, when they provide all spa services. So you can visit them at Sogakope for your spa services. We'll go for a short commercial break. When we come back, we'll find out what a cesarean section is.
This advert is FDA approved.
Introducing new Sunlight 2-in-1. It gives you burst, after burst, after burst of long-lasting freshness. New Sunlight 2-in-1 for burst after burst of long-lasting freshness.
Mommy is coming!
Have you cleaned the kitchen? Done all the chores?
Yes, ma'am.
Then it's time for
Dole yogurt. Dole yogurt. Everybody grab Dole. It's delicious, creamy, and refreshing too. Mommies love it, and dads enjoy it, and the children, they love it. Raise a cup is Dole yogurt. Raise a cup is Dole. Raise a cup is Dole yogurt. Raise a cup is Dole. Dole yogurt.
This advert is FDA approved.
Welcome back. If you just joined us, it's still Pregnant Care Show, brought to you by Vena Mineral Drinking Water and Dole Yogurt. So, Doctor, I want to find out what is cesarean section or C-section?
Okay, so cesarean section or C-section or cesarean delivery is just an operation that involves making cuts on the abdomen and the womb and taking baby out.
Okay.
So that's cesarean delivery.
Okay.
Instead of the normal birth, which is through the vagina. Then this one is taken through the abdomen.
So this is a surgery that is performed in theater.
Yes.
Okay. To take out the baby.
Take out the baby. Okay. That's all about cesarean section.
So who performs a cesarean section?
So cesarean section is performed by a trained medical doctor.
It's not like you have a specific group of doctors.
No, you don't have a specific group. Although some of them can be complicated.
Okay.
Whereby the obstetrician would have to come in and do it. Yes, but it's mainly by any trained medical doctor should be able to do a cesarean section.
Cesarean sections, okay. So most often the obstetrician steps in when it's a bit complicated, if that is what you are saying.
If we have luxury of obstetrician all over the country, then it means that it's going to be performed by obstetricians all over.
Okay.
But because we don't have that luxury, any trained medical doctor should be able to perform it. But you know, there are some complications that
might arise during the procedure.
No, like during the pregnancy, known complications
already.
That's you need an obstetrician in some facilities to be able to do it.
Okay. Do we have types of cesarean sections? And if they are, what influences the types?
Okay. So we can look at it this way, whether emergency and elective cesarean section.
Okay.
So elective cesarean section, we are talking about a planned operation.
Okay.
So this one during the antenatal period, the woman, there is an ongoing discussion
with the
woman, with the doctor, and then the pregnant woman or the couples.
Okay.
And then the date is fixed, and then the operation is done.
Okay.
Let's say, example, you've had a previous surgery before. Maybe you remove fibroids. That this one, delivering yourself will be dangerous. Yes, your womb might rupture. Okay. So this one is something we planned early ahead. So this one is elective cesarean section.
Okay.
But sometimes there's no problem.
Okay.
The plan is to have vaginal delivery. Then during the course of the labor, they realize that no, maybe there's a problem with the baby's breathing. So quickly they have to go in and take the baby out. So that one is emergency cesarean section.
You've just given us one cause that maybe there's a problem with the baby's breathing. Then you could call for emergency cesarean section. What other factors could also still account for the emergency cesarean section?
And there can be instances where all of a sudden there's bleeding from the placenta.
Okay.
And this bleeding is what feeds the baby. When they consider it, if they have to go in quickly to save both the baby and the mother, or the baby doesn't position himself well along the line.
Okay.
No, when the baby must come out, it must come out with the smallest diameter. It must flexed. Okay. Along the line, if the head is a bit deflexed, then the labor will not going to progress. Okay. So there must be an emergency cesarean section. Or sometimes the cord that connects the baby to the mother comes out
before even the baby.
Yes. Once it comes out like that, it's not supposed to be out.
Okay.
So quickly there must be an.
Okay. So you are basically saying that there are factors that might disrupt the labor that might need a surgery. So that is what we term as the emergency surgery. But the elective is the one you plan ahead during the antenatal clinic. That is if the woman will be at risk of having the normal vaginal delivery. Yeah. So is CS a major or a minor surgery?
It's a major surgery because it involves a lot.
Okay.
You know, they have to go into the abdomen and go into the womb to take the baby out, and involve anesthesia and all that. Okay. So it's a major surgery.
How long does it take for a cesarean session to be completed when you go to theater and you want to find out what actually goes on in the theater?
Okay, so for the time, uncomplicated surgery, 30 minutes to 1 hour, it's fine. Yeah, you are done. But sometimes it can be complicated. Okay. Complicated in the sense that maybe you've had operations before and there are lots of adhesions. Some of your organs are joined to each other. So you need to take time patiently to separate them before you get to where you are. Okay. And sometimes there may be fibroids too on the womb maybe at the lower segment where the babies will pass.
Okay.
So it's blocking the route.
Okay. Okay. Let me come in before we still continue with the fibroids. I think we would have to invite you to come and talk to us on fibroids.
Okay.
But most of our pregnant women, they do say that they have fibroids, but during the cesarean section, it's not taken out.
Okay.
They will tell them that maybe after the surgery, they will take it out. We don't get it. How?
Yes. So the thing is that when you are not pregnant, your womb is just like this, very small, maybe even smaller than this.
Yes.
Yes. But you realize the case when you are at term, the whole womb is like this, very big. With a baby inside.
Okay.
There's a lot of blood in there.
Oh, okay.
Going in and out. So the danger is that unless the fibroid is just hanging, that you can easily tie. If not, when you take it out of the womb, there's a lot of bleeding.
Okay, how scary is a cesarean section?
Unlike earlier on, now things are more refined.
Okay.
That's sometimes you say. And the main fear or what makes it scary is the pain that someone may feel. And also blood loss.
Okay.
Like they're going to lose a lot of blood. But we give anesthesia, injection at the back to numb the ear, so you don't feel pain during the surgery.
Okay.
And after the surgery, so there are injections we can give you with the blood loss to measures put in place. It's minimized controlled as much as possible. You
are saying that before the surgery, you're actually giving some strong painkillers before the surgery. So with that, is the person completely gone as in unconscious, or now you can actually be conscious where the patient is going? Because I used to know that initially they are unconscious, but I also heard that now your eyes could be open while they are cutting, they are talking to you. How true is that?
Yeah, it's very true. There are various forms of anesthesia, but then there can be instances where maybe you have a problem at the back. People have problem at the back.
Okay.
Or maybe it's an emergency. You are losing blood a lot. Your BPs are getting low. And other instances where they have to put you to sleep. Yes, so that one they will put you to sleep and then do the operation for you. That one you won't be awake to see what is happening. Yes, so when they finish the operation, then
you can revive. You get back to your conscious level.
So they just give you some medications to sleep.
Okay.
That you won't feel the pain. So after the operation, they give you injections to get out.
Okay. So who makes the decision for a CS? Is it the doctor or the couples?
The decision is a shared decision.
Okay.
But then it's based on the professional advice.
Okay.
So in that way, the doctor is the one who is calling for it, but it's in consent of the couples. So
do we have instances where a pregnant woman would request that, okay, for me, I want to have a cesarean section?
Yes, okay. It's there. A lot of some women request for it. Some of them is based on their previous experiences with their, maybe she had a delivery and she felt it wasn't a good experience. She had a lot of pain, or at somewhere else. When she comes, she says she wants cesarean section, and if she states that, most often than not, we tend to give them their choice or their desire. Yeah.
Actually, you can opt for a cesarean section if you wish. It is not solely their decision. And as well, we have two different types of cesarean section. We have the elective one that the couples and the doctor, they plan ahead of time, depending on your situation. And then we also have the emergency one, maybe during your course of normal vaginal delivery. If anything should go wrong or there's any abnormality found with that period of the vaginal delivery, then they will quickly prepare you for the emergency cesarean section. Let's go for a short commercial break. When we come back, we'll find out why a cesarean section is necessary.
This advert is FDA approved.
Introducing new Sunlight 2-in-1. It gives you burst, after burst, after burst of long-lasting freshness. New Sunlight 2-in-1 for burst after burst of long-lasting freshness.
Welcome back. If you just joined us, the show is still the Pregnant Care Show. We are looking at what a cesarean section is. And the show is brought to you by Vena Mineral Drinking Water, changing people's life, and Dole Yogurt. Okay, so can a woman after a cesarean section have a normal vaginal delivery?
Yes. So, gone were those days when they said once cesarean, always a cesarean. But now, when you have one cesarean section, you can give birth after. I mean, you can deliver yourself, and mainly those who normally have success at that are those who have had previous deliveries, or who had delivered after the CS before, and but it's not all the CS that they would allow you to deliver yourself. Normally, when when we are doing the operation, we go just down here. And then even on the womb too, we cut down. But there are situations where they have to extend it up. When they extend it up like that, it's not advisable to deliver yourself, because the risk of you having a rupture during your neck is high.
So you could still be giving consideration, also depending on few factors as well. But actually, it's also there that after a C-section, you can still have a normal vagina. So what is the interval after a cesarean section for a woman to get pregnant again? Do you have a specific time?
The 2 years is for every delivery.
Even for the normal vagina.
Because what has been found out was that if you deliver early, if you deliver now and you get pregnant earlier, less than 2 years, normally you will have problem with your blood level, anemia. You have problem, you have prematurity, or the babies you give birth to will not be big enough. The weight will be low. This and other issues. So it's been advisable that after any delivery, you wait 2 years before you embark on another journey. But then for the scar, after let's say 12 months, the scar should be, it can be enough to get pregnant again. In the UK, for example, if your last delivery to the time you are getting pregnant is 12 months, they can allow you to try and give birth yourself. The other thing is that if, God forbid, let's say you've embarked this journey, one reason or the other, you've lost the baby, it will be difficult to advise you to wait for 2 years to try getting pregnant again. Or let's say you are 39 years
already,
and you want to have. So some of these factors too come into play when you are giving advice or you are counseling somebody.
So do you give all this counseling to the women?
Yes, it's an extensive counseling, and it's not at one sitting.
At every visit.
Every visit,
So let's hit the street and find out what our viewers have for us on today's episode.
Your friend Charity, community and me woman. Ye kona ye pie e mana. Omu fi say omu nye ema. Omu pushi. Kolana oma woman. Omu fi say omu nkwa na ye oma. But mpese me ma doctor advise you omu say wa pushi akolana wa wo no na say wa wo easy no. Ye nyina ye ema.
Ye CS nkola any nkola like omu ma me pushi omu first labor omo de wo omo no omo ni CS nkwala na ya difference kakra wo muntem aya menti ase but omo betumi a share me ase ana
ye frɛ me na mpese me mpisa se my sister ko ye CS no ya onya etipae ni back pains mpese me mpisa se normal na no nko hu ni doctor.
Welcome back. So that was our Vox Pop session where we have viewers asking lots of questions. So Doctor is going to address all those questions being asked on the street. So Doctor, this is from one of our viewers from the street. She says she's been having this headache and back pain and spinal pain after her second cesarean session. So she's saying it is the CS. How true is that?
Because normally we say we give spinal.
Yes.
And the spinal involves introducing injection into the spinal cord to to make the place numb. Sometimes you do have some the headache and then pain there, but then some of these things, if you have this problem, you need to come back to the clinic for these issues to be addressed. Most of the time you can encounter this, let's say within the week of the operation, but then there are things we do that can stop the headache, and sometimes also the headache the person is having may be something different, may not be even be related to the operation, but because he had an operation, he's putting it on it. So it will be best to go back and have a comprehensive healthcare check.
So our next viewer is saying that she has heard that babies born through CS, they behave differently from babies that are born from the normal vaginal delivery. I don't know how true that is, so maybe you have to help us answer.
Yeah, so cesarean section has been here with us for centuries. And most of the people you see around here, the clergy, the ministers of state, and some of them have gone through cesarean section.
Okay.
And there has no documented evidence of
differences in behavior.
Yes, behavior among them.
So there's no different. Behaviors are not, they don't differ per how you are delivered.
Yes.
Oh, okay. So our next viewer is saying from her community, if you have a cesarean section and operation done for your baby to be delivered, it's either that you are not strong or you've offended the gods or you've done something wrong. So this is just a cultural belief.
Yeah.
I'm thinking so.
Yes. It's cultural belief because, as I was saying, for a baby to come out, there are three things: the baby itself, the passage where the baby is passing, and then the power. So if baby, let's say normally people have, if you have given birth a lot, let's say 5 or 6, your womb and all that is laxed, it can make baby lie, instead of lying with the head down, it can lie across, lie across. That one is not the gods, because your womb and things are a bit laxed. Or if you have twins, they can lie like that because they were competing for space and all that. They can lie like that. It's not the gods.
So women who do undergo a cesarean section is not because they've offended anybody or they are weak or anything, but medically things happen during pregnancy or during delivery, which one will opt or would need a cesarean section. So do not worry if you have to go undergo a cesarean section. Or babies do not differ in behavior because they were born through a C-section or through a normal vaginal delivery. We'll go for a short commercial break. When we come back, we would have a couple moments.
Have you cleaned the kitchen? Done all the chores?
Yes, ma'am.
Then it's time for
Dole yogurt, Dole yogurt. Everybody, grab Dole. It's delicious, creamy, and refreshing too. Mommies love it, and dads enjoy it, and the children, they love it. Raise a cup is Dole yogurt, raise a cup is Dole, raise a cup is Dole yogurt, raise a cup is Dole. Dole yogurt.
This advert is FDA approved.
Introducing new Sunlight 2-in-1. It gives you burst after burst after burst of long-lasting freshness. New Sunlight 2-in-1 for burst after burst of long-lasting freshness.
This advert is FDA approved.
Midende, Mrs. Sabina Agbeku. Me seamstress, I'm a pama dear or dansoma. True, a Juman me panin saying. Minya 7 months, no, and I mean who say in Suya start ye gume. Enti Emma Bera she me call hospital, a polyclinic. na yɛde me yɛma me reference na medical kolebu nti me call kolebu no na yehu sɛ akwara ne de call na akyekere ne kon nti sɛ ye delay kakra ebe ha me nti yɛde me call theater na yɛyɛ me CS but ade akye ye no na me hu sɛ akwara na fim because of me cheye nke wo sɛ me da na ade ne start sɛ yɛ me Wednesday na na sɛ me call hospital but me twen ya up to Friday enyumra ade bechi Saturday ansana me ko na chese me che wo fie dodo ntika ya ade adana ade ne ye me na me ko ya nke bi ebetumi asave akwala no na CS no so emba so ba because of me che wo fie ni nti ema ye me CS eso amansa enya akwala na nka ho enti no me advice to obabia ne se nyame ya wadom na wo fa yefuna fiti day 1 wo piti pain kitu akura ment ne fie aye me 2 times inti me mpesa obabia nso bekom inti me sure obabia nkran se nyame ya wadom na wo fa yefuna menche wo fie se bibi uti pain ana se wo fo ya obi mu a obehu doctor ntem nurses ne de no kura ne se o mo behwe yen but nya advice bia o mo de ma yen because nurse for ni bi ka chem se me ntwen po Monday inti nka ya de a me amitie ya wa me femu na me call earlier before dinner nka me mfa saa o ya we mu inti no me sure baby ankran say bibi ebesi intentem bia hu doctor na bibia be fine.
Welcome back. So that was a couple moments where we had a couple sharing her experience during the cesarean session and what made it actually go for the cesarean session. There was this case I read somewhere. It was about a woman. She said she was requesting for a cesarean section. Okay. Or maybe some women will say they request for a cesarean section. The doctor didn't give them. They were denied and their baby died and even their womb was removed. How true is that? Have you had cases like that? Because on media I have heard people coming out with those testimonies.
These scenarios, it doesn't happen here in our hospital here in Holy Trinity.
Oh, okay.
Yeah, but places where there are a lot of clients, I mean, when you go to places that they do about 400 deliveries a month, there's pressure. I mean, the referral centers. What can happen is that if, let's say, a woman requests for CS, sometimes because she's in pain, labor pain.
Yes.
Which is, let me say,
not seen as a reason.
Yes, for surgery. Okay. But they are monitoring her. Then all of a sudden, they discover that the baby's heart is not good. It's dropping. Then they need to operate. Okay. But then, in the course of that, then they rush in somebody bleeding heavily. They are going to lose the baby. They are going to lose the mother. Do you understand? When you compare somebody who is bleeding heavily, let's say there are some cases ongoing right now, and then that woman, you want to save
the bleeding,
the woman, yes, because she's going to die with her baby. Do you understand? So some of these things can happen, but it's not an everyday occurrence. I see it mainly because of lack of resources.
Okay.
Yes, or too much pressure on the available resources.
What would be your final words to our viewers on a cesarean section in general?
Cesarean section is not a do or die affair. It's to help deliver a baby. A baby you've been dreaming of for the whole 9 months. It shouldn't be scary. You should always feel free to ask questions, to talk to your obstetrician, your doctor about it.
So doctor is saying CS shouldn't be a scary procedure or a process. So make sure you talk to your doctor, plan it well, have every information you need to get, and then you'd have a safe and a relieving cesarean section. Our tip for this week episode is: few days to your C-section, do well to effectively continue your personal hygiene care to reduce rates of post-cesarean section infections, and also feed more on light meals and drinks, enough fluids for hydration. Discuss with your doctor on any medications you are on if you need to stop or to continue with it. So on today's episode, we were looking at what a cesarean section is. Doctor made us understand that it's an operation where the baby is being removed from the womb through a surgery, and they have the elective one that is planned for, and then the emergency one that is done at any time during a normal vaginal delivery. There is nothing scary about a cesarean section, so at any time you can request for one as and when. The show was sponsored by Vena mineral drinking water, and Dole yogurt as well. So if you have any comments, if you have any questions, kindly leave them in our comment section on all our social media platforms, and keep subscribing to our YouTube channel. Dr. Mensah Adolf, we want to thank you so much for coming on our show, and we are looking forward to having you more on the Pregnant Care Show. Thank you so much. It was fun having you. So we'll be seeing you some other time.
Thank you too.
Okay. So viewers, thank you for watching today's episode. If you have any comments, if you have any questions, kindly leave them in our comment section on all our social media platforms, and keep subscribing to our YouTube channel. See you next week for a more interesting episode.